Don't forget to subscribe to the MFine channel and hit the bell icon to never miss any update.
Today we are going to discuss a very common concern that parents have and may need to consult a pediatrician for, and this is for common cold and cough. Now, we are having a kind of resurgence in viral illnesses, flu-like illnesses. We are also seeing fevers due to dengue and a few cases of COVID-19 again among kids. So it's kind of important to understand what is to be done when to consult a doctor, and very importantly what is not to be done when you face this situation at home. So what do you do when your child starts having cough, cold, running nose, sneezing and perhaps mild fever? First and foremost, don't panic. Remember that 99% of common cold-like illnesses in children are viral in etiology. So you don't have to panic and start an antibiotic as the first thing. Antibiotics are only useful in some situations, particularly when there is, say, persistent high-grade fever, perhaps more than 48, 72 hours, with a sore throat or a change in voice, which may or may not be accompanied by enlargement of the lymph nodes, and when oral examination of the throat shows evidence of infection. Say it may be in the form of redness, pus pointing regions or enlargement of the tonsils, etc. Barring this, in most other situations, particularly when there is low grade fever and there is multiple family members in the same home affected with cold and cough like symptoms, most of the times we are dealing with a viral infection, in which case an antibiotic is not useful. The most important principle of treating common cold and flu-like illnesses is to give the child adequate hydration, lots and lots of fluids. So remember, when we say fluids, it can be in the form of homemade fluids. So what do we mean by homemade fluids? Of course, there is water. Give your child plenty of warm water. Give your child other fluids that he or she may like buttermilk, coconut water, vegetable soups, fresh homemade fruit juices. It may be cereal porridge. You can give even oral rehydration solution mixed with water, maybe a pinch of lime added to water. Some others would prefer to give barley water, oma water, etc. So any kind of fluid which the child is able to take and accept is acceptable. Also keep giving your child regular small meals or small feeding. If your child is still breastfeeding, please do continue breastfeeding frequently. You may want to give whatever homemade soft diet the child may want to take, like idli or upma or some khichdi. You may give rice, mashed fresh vegetables, etc. Very often parents ask us, is there something which we should not give, particularly curd or banana? Now there is nothing scientific behind this that you need to avoid a certain part of your regular diet. Most of the time fresh curd is absolutely safe and is a good source of probiotics, and this need not be avoided during a viral infection. Now the next important aspect is plenty of rest. Your child needs to take a lot of rest, maybe take a midday nap and then adequate rest during the night. So if your child is going to a daycare or to a school, do remember to inform the teacher or inform the caretaker at school that your child is symptomatic, and if possible, try to avoid sending the child to the daycare or to the school until he or she gets completely better. Now, in terms of getting investigations done with the current pandemic situation, it may be a good idea to consult your doctor to find out whether a COVID test or a RT-PCR needs to be done, if not for really changing treatment, but more importantly to decide whether there is a need for home isolation, particularly if you have elderly parents staying with you or individuals with comorbidities. So it may be just for decision making on whether isolation or quarantine may be required, and not necessarily to change treatment, because mild COVID also doesn't require any specific treatment. Now, in terms of other investigations, you don't have to rush and get blood counts and tests like CRP, etc., especially when the illness is brief, transient, and when the child is otherwise active, feeding well, passing urine. The indications for getting further evaluation again are generally based on the consultation with your doctor. Your pediatrician may decide to get your child investigated if there is high grade persisting spikes of fever for more than 72 hours, if there is an associated rash, associated say sore throat where you may want to run a rapid test for a streptococcal antigen, etc. etc. So do not really jump for getting additional investigations done. Now, what can you do? What else can you do? Now, if the child also has fever, particularly fever which is more than 99.5 degree Fahrenheit or fever which is associated with limitation of activity, limitation of appetite significantly, then you treat fever by starting paracetamol. Paracetamol is generally a very commonly available remedy which most of us have at home. The typical dose is 10 to 15 milligrams per kg per dose. 2 doses of paracetamol are generally separated by a gap of 4 to 6 hours. Now, paracetamol, very importantly, you should remember, is available as both a suspension as well as a drops, and these are available in different strengths. So, if you have any concerns with this, please do consult your doctor before giving paracetamol, and the gap should be strictly 4 to 6 hours. You can intersperse, cold sponging and wiping the baby if the baby has fever spikes in between 2 doses of paracetamol. The role of other medications, antipyretics like mefenamic acid or brufen, are restricted and should be only taken with the consultation of your doctor. So never self-medicate with drugs such as mefenamic acid or with brufen without a formal prescription, because these are associated with more toxicity, side effects, stomach upset, gastric irritation. The child may develop vomiting, especially when it is given before food or an empty stomach. And the doses also are more complicated, and you definitely need a prescription for this. So in summary, the treatment of a common viral cold cough is essentially about plenty of hydration, rest, giving the child frequent small meals, continuing breastfeeding, giving liberal intake of fluids, treating fever with paracetamol. Consult your doctor if the symptoms are persistent, particularly if there is high-grade fever of this or if the symptoms interfere with the regular activity. Now the role of antihistaminics, decongestants and similar cough and cold remedies are kind of not very valid scientifically, but they may help in symptomatic relief, and you may always want to consult a pediatrician before you go ahead with any of these medications. Antibiotics are truly indicated in less than 1% of all episodes of cough cold, particularly in children less than 5 years of age, and never abuse antibiotics again without a real need. Thank you. I hope this video was useful to you all. Bye-bye.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.